Hello, my name is Taylor Galownia, and I am a student at George Mason University, graduating in May 2020 from the Masters of Health Informatics program. This presentation, titled Practicum Experience, was prepared as part of the HAP 789 course in Pre-Capstone Development, taught by Professor Green. As we begin to wrap up week 6 of our Pre-Capstone Development course, I wanted to take the time to share my practicum planning experience thus far. I spent much of week 1 reviewing the capstone practicum, logistics and requirements, and asking a lot of questions to Dr. Green. Once I had a good idea of what the project entailed, I began seriously brainstorming ideas for what type of project I wanted to complete. I work as a business intelligence analyst at a non-healthcare organization and thought it would be exciting to blend over some of the skills I have learned on the job with those that we have learned in school and complete a business intelligence focused project. I then began thinking of which sector of healthcare I would want to perform this project in. I spent about a year working as the patient care coordinator at a pediatric practice prior to my current job in business intelligence, and immediately thought of how these smaller medical practices tend to lack the technical expertise to really put any intelligence around the numerous data points they collect from patients, insurance companies, invoices, etc. This is what made me decide that I wanted to do my practicum for a small medical practice, providing them insights into their data to help manage their business. I spent from week 2 up until now calling several doctors' offices in the area to pitch my idea and see if they would be interested. Most of the time, I had to leave a message for the office manager. In these cases, I crafted up a letter and sent it to their office along with my resume. So far, I've only heard back from one medical practice, which I will explain in more detail in the next slides. As of now, my research topic is not set in stone. This is simply the idea I have as of now, but I am very open to changing it based on any needs of the organization I ultimately end up with. My current research topic idea is as follows. Can the implementation of business intelligence, reporting, and analytics help a small medical practice increase efficiency, boost revenue, and predict future events? To execute this research, I would want to feed the organization's data into a business intelligence tool like MicroStrategy or Tableau and build visualizations and reports around it. My hope is that by giving the practice a visual depiction of their data in the form of trends, graphs, clusters, etc., that they will be able to make more data-driven decisions that ultimately help their practice succeed and keep patients happy and healthy. I would test whether the implementation of business intelligence tactics helps these areas by measuring performance metrics at the beginning of implementation and then after 3 months at the end. These metrics could be around revenue, number of patients seen each day, number of new patients, etc. At this point in time, I do not have a finalized site to complete my practicum at. I am realizing it can be hard to get in contact with the right people quickly because everyone is so busy. I did, however, reach out to a friend whose mom is the doctor at Ashburn Pediatrics, and she relayed over contact information for their office manager. I have already spoken with the office manager on the phone, and she is going to get back to me regarding my project sometime next week after their EMR manager returns from vacation on December 3rd. I am hopeful that this site will work out and am anxious to hear what the EMR manager has to say. I do not yet have a preceptor for this project, as I have not locked down a site yet. As I mentioned on the previous slide, I'm waiting to hear back from the office manager at Ashburn Pediatrics after she speaks with the EMR manager to see if there are any opportunities to do my project at their site using their EMR data. I would imagine that if this site does work out, then either the office manager or EMR manager would be my preceptor. I think I would be working very closely with the EMR manager, so she would most likely be the best option for a preceptor. Overall, I have been working hard to lock down a site and will be very excited and relieved once I have something finalized. This has been a good learning experience for me, as I've never had to do warm calling to any organizations. Hopefully, in the next few weeks, I will have good news and a proposal to turn in for my project. I am looking forward to beginning my capstone project in just a few short weeks. This concludes my presentation on my practicum experience. Thank you.